Good afternoon. I'm here to talk about the deployment that we've done of My Pathway, which is essentially a digital platform which connects patients to their healthcare. I'm a rheumatologist working in Sheffield Teaching Hospitals, and we've been doing this work within that environment. So just to start by introducing what MSK Sheffield is, it's a combination, basically working as a kind of combined provider of community physiotherapy, elective orthopaedics, functioning both as Sheffield Teaching Hospitals and also independent sector providers within a managed contract, the hand unit, rheumatology and the chronic pain service, and that together accounts for around 47,000 patients newly referred into the service each year. The CCG essentially recommissioned this service about 3 years ago, and they asked for an outcomes-based, single point of access, integrated MSK service. And our response to that as Sheffield Teaching Hospitals was to co-design a model with our patients with mandated electronic referral by GPs into that service. And that meant quite a lot of reorganisation across the city for all of MSK care. And importantly, made us focus on measuring and reporting on patient outcomes. So our challenge was to collect and report clinically meaningful patient-reported outcome measures, so PROMs, across multiple treatment pathways for 47,000 MSK patients annually. And clearly we felt that there was a need to do that via an IT solution, so a paper would have meant an army of people. But importantly, a parallel non-IT process to follow on later for those unable to engage with IT. We involved our patients right from the word go and designed the initial specification for the product with our patients. We went through a European tender, which patients were very much part of in judging the providers as they came through that process. And we signed a contract in December of 2016, and we're delighted to do so with ADI, a Yorkshire-based company who really shone throughout the tender process. So My Pathway is a web-based platform and app, so it works across all smartphones, tablets, PCs, and functions as a communication portal linking patients to their MSK care. And really it does three things. It displays and facilitates the booking of appointments. It asks patients to complete PROMs and PREMs at relevant points in their care, asking the right question to the right patient at the right time. And it does that in an automated way by linking the product back to our IT, so we use Lorenzo within the hospital and we use System 1 within the community physiotherapy arm. The events that exist and are known by those IT systems link automatically to My Pathway, so if someone's going to have a hip replacement next week, the system knows that, and it can then tailor automatically the PROMs that we ask to the patients at the right points in their care. It's also capable of providing patients with access to generic and pathway-specific resources, such as maps as to how to get to their appointments, leaflets about the treatments, exercises, videos that are relevant to the condition that we're treating them for. And very much our overall strategy was to encourage the uptake and use of My Pathway by making it an essential part of patient care. We could have just designed a system that was capable of collecting PROMs, but we weren't sure how many patients would integrate and use with that. So we've made it very much part of an essential part of patients' care. So these are just some screenshots of My Pathway. So when patients are referred to us, they're invited to register for My Pathway. They go through a consent process that tells them what their data is going to be used for and who it's going to be shared with. They then receive access to My Pathway, which essentially functions as a timeline of their care going forward. It tells the patient that we as a provider have received their referral. We have a process of electronic triage where clinicians determine the most appropriate service for the patient to be seen by. These little blocks on the screen we call lozenges. If you click on a lozenge, you get much more information about what sits behind that. Once the patient has been triaged, they then get a notification to say that they can book their appointment, and My Pathway links them through into the national e-referral system, which then allows the patient to choose their provider, the time, the location of their choice. And once that's happened, then their appointment shows up on their timeline telling them when and where it is, and they get further information about locations. So these are just the screens which take them through that booking process, and as you can see, they then get a lozenge that tells them that they've got an appointment in the rheumatology clinic, and they click that lozenge and it gives them more information. At the same time, we're asking patients to complete PROMs. This is just an example of EQ5D, which we're using as a generic health PROM across the system. and the patient's asked to complete that, and then they go through the relevant screens and complete that before they're seen. So the work that we've done to date, we've integrated My Pathway with Lorenzo, which we use as our EPR within Sheffield Teaching Hospitals. That was a relatively straightforward process, and there's a flow of HL7 messages into My Pathway, which gives us all of the patient information. We've recently also integrated with System 1, and we've done a staged implementation by the services within MSK Sheffield, so rheumatology, orthopaedics, pain, and then physio, with the initial focus on getting communication of appointments right, such that we've been able to turn off paper, so we don't send letters to those patients who are signed up and engaged with My Pathway, saving us a huge amount of money in terms of postage costs. And also, we've used My Pathway to generate paper for those patients that My Pathway knows haven't engaged electronically. So we know who is electronic, who isn't, and we send letters to those that haven't engaged electronically. The pathway exists in the background for all patients, whether they're electronic or not. So if later patients want to join in with it, they can, and they get all the benefits of doing so. We're collecting generic PROMs across all of our specialties, and now we're starting to move the focus towards particular treatment pathways and disease-specific PROMs, including the potential, which we're piloting at the moment, for virtual follow-up of patients via My Pathway. So instead of patients having to trawl up to the hospital to be seen, they can answer PROMs in advance of the appointment, and those people who are doing well don't necessarily need to come and see us. So this is just some data to show the proportion of patients who are currently using this. So of the 16,000 patients that have so far been invited to use My Pathway, we've got sign-up and use by around 7,500 of those, of whom, of those registered within the last month or so, around 70% are completing their baseline PROMs. Prior to the introduction of My Pathway, we had lots of patients who were kind of stuck in our admin system waiting to be processed. So we were contacting patients to book them their initial appointments, and now they're doing that themselves. So we've got very few patients who are stuck in the admin processes within the booking system, and we've shortened the patient time from when they're first referred to when they've got a confirmed appointment by a week, which obviously helps enormously with 18-week pathways. So key learning. There's been a lot of upfront clinical leadership time, putting what's right for the patients first and engaging patients right from the get-go. We've got a patient panel that we use and have checked everything that we do. It's been properly resourced, it's been co-designed with patients and with great input from the Good Things Foundation, who support patients to become digitally engaged. We've had great cultural collaboration within Sheffield Teaching Hospitals, with the primary care, with our CCG, and with ADI in collaborating and designing this product. The outcomes process is still a work in progress. It's going to take time to establish, and we'll need a period of baselining before it can be useful for commissioning purposes, but we think we'll get there. Just like to acknowledge one or two people. So Jill Lomas, our program manager, who's with us today, lots of what's happened wouldn't have done if she hadn't been there. We've got an MSK steering team, the STH, IT and governance teams. The CCG, our CCG, have been phenomenal to work with and have funded all of this product. And ADI, the company, for going well above and beyond throughout for the benefit of our patients and our product.